Hey there, Stephanie Joy with all things Social Security and the law practice of Joy Disability. Here's a short little segment from our recent live stream Q&A that we have every Wednesday at 1 p.m. Eastern Standard Time on the YouTube channel, All Things Social Security. Enjoy, and if you have any questions, leave them down below in the comments, and I will be sure to get to them. Thanks so much. Bye-bye now.
Matt, hello from Virginia. Hello back at you from PA. Thank you, Kathy. Kathy says, y'all can hear me. So you know if you can't, it's on your side, not my side. Okay? For once, right? Patient in the house. Hi, Mike. Good to see you. Hey, Beth is in the house. Hi, Beth. Long time no see. Thank you all. Okay, so where are we at, guys? Any questions? It's been a busy week here as we're getting some new softwares. Oh, Danny, you like my hair today? Maybe it's a good hair day. Yeah, it can vary for sure. I think the shampoo matters too. I've been playing around with a few. Elliot says, as an advocate for the chronic pain community, I can tell you from many people's perspectives, grief counseling is often beneficial when dealing with a lifetime illness. Yeah, I'm not sure I would even call it grief counseling, only because I wouldn't want people to confuse it with when you lose a loved one to death. Just as death grief counseling is different from divorce grief counseling. Sometimes I think that's when you lose a loved one to divorce, it is different than losing it to death. It's in so many ways, right? But yeah, I think I had my Aunt Wynn, who was not really, gosh, this is really bugging me, guys. I feel like a big head. Do I? Yeah, I do. Like I'm all over. I remember she had lost a close family member, I think a sister, and she was older. I mean, she was probably she was probably close to my age now. So this is going back. She has since passed away, but maybe 15 years ago, we were out to lunch, and she explained that when she lost her sister, she was so devastated and, decided to get grief counseling because it was you can fall into a depression if you don't learn how to handle grief in a healthy manner. And I could say that from a perspective because when I was 14, my younger sister, who was 13, got run over by a car and killed at the bus stop. So I know that was very different because it was traumatic, involved family members and, the whole family. But, we didn't really probably handle it in the healthiest of manners. So I do think it's a big deal. And particularly when grieving people can't really counsel each other too well. So I do think an outside source is a really good thing. And I think, and Elliot, I don't know if you would agree with this or not. Going back to what my aunt said, sorry. She went to a grief counselor and she said, the grief counselor said, I expect you to be discontinuing with me in 6 weeks because that's all you're going to need. And lo and behold, she stopped in 6 weeks and she said it did the job. And I was really impressed by that because, grief can be something that will cling to you for years and years and years and decades and cause unhealthy decisions and even like an unhealthy outlook on how happy you should be when your loved one is no longer here. Like if you're going to be happy, maybe you are being disloyal. I mean, I went through all these things for a long time. I think my husband and one friend who said something inadvertently on social media very nicely were the two sources that actually made me see differently. And I was like late 40s probably. That's how long it can go on. So I totally agree with that. And I agree there's obviously different kinds of counselors for it. So just the terminology, I think, can be confusing. But for chronic pain, what do you think about? I mean, I guess they call it counseling for adjustment disorder. But also, it's not just adjustment disorder for that, because all what we're talking about is adjusting, right? Adjusting healthily to something. Possibly, and I'm saying this as a non-mental health professional, guys, just comes to mind. this is the way I think. We all are going to have different ways of looking at it. Chronic pain, I think also sometimes, and we talked about this, was it last week or in a different video? Coping with the, like learning tricks. I don't want to say tricks, but it's like tricks or like tips to cope better with pain. So maybe it actually the mental part can help mitigate the pain because we know our minds are very involved with our bodies, right? I know it is a fascinating thing, and I know in the 80s when my family went through what we went through, there you didn't go to mental health. That was when it was very stigmatized, and I guess part of the problem is we call it mental health. Grieving is not mentally unhealthy. It's when you don't do it healthy. It's kind of like eating is not unhealthy unless you do it unhealthily. Drinking is not unhealthy unless you do it in an unhealthy manner. So I think the problem is they call it mental health counseling. And it's not that that's wrong because you are trying to maintain the good mental health you have. And, by making sure that you do all the things that could otherwise tear it down. Grieving, in an unhealthy manner, not realizing you're doing that. I don't know. What do you guys think? Thoughts? Elliot, as an advocate for the chronic pain community, I would also say, in that vein, we could do a video, Elliot. If you have some, probably, yeah. I mean, if that's something you do and you're actually out there and you kind of have spoken to maybe some experts and stuff, in that field, that'd be something to share. I don't know. What do you think? Cold Man, RXP. Hi, Cold. I don't think we've met. Nice to meet you, and thank you for being here. This is Tasha. Right, Tasha? Yeah. Cold says, I am almost 63 and was approved in February. I'm very happy for you for SSDI. I have Meniere's disease, and my balance is so bad, I hardly ever even drive. Just wonder if I would ever be likely to get a CDR. Unlikely. I mean, unless you screw up and do something completely inappropriate, I don't think you're going to. I'm guessing they put you. Do you know what your diary is? I mean, if they put you on a 1-year diary, which I doubt with that condition, then yeah, you're probably going to get one. But they probably didn't. And if you don't see it in any paperwork, Cold, you can call your field office. It will not detract from your case or cause a CDR, guys. It will never do that to call and get your diary date. And the diary date, of course, sometimes it goes longer than that because, they get other priorities. Okay. William S. Hello, William. I received a CDR about a month ago, and the printed CDR on the envelope freaked me out. Why? Hey, Kosher's in the house. Hey, I heard something about you, Kosher, from a fan of Walter's channel. Said that you are a excellent moderator. So someone just gave you a big, huge, kudos. I just wanted to share that with you. That was super sweet, I thought. Barbara Gillespie says, can you get back pay for survivor's benefits? Yes. Was denied disability 4 years ago, now found disabled as of 1 of 2020. Okay. You can get back pay for survivors, but it's going to stem from your date of application. So the extent of, back benefits, like everything now with Title II, and certainly with Title 16, which is the SSI welfare part, there is limits to back benefits stemming from your date of application. Now, interestingly, before my time doing this, there was, I'm pretty sure it was before my time, I think there was not a back benefits limit. Imagine that, guys, filing 10 years later, proving you were disabled 10 years ago, and getting 10 years of back benefits. Oh my gosh, imagine that. That would be so amazing. I understand they have to do the statute of limitations, if you will. I do understand it. People need to poop or get off the pot. But Just can you imagine what that must have been like? Ha, wow. There would be a lot of wealthy people on disability. That would be so awesome, wouldn't it? Right? Yeah. So it's going to depend when you apply for survivor's benefits, and that was assuming after you were a survivor of somebody under whose record you would be eligible for, and when they find you disabled. You're not going to be able to go ever before any of those dates. It's going to be the latter, the date they find you disabled, minus the, you know what I mean? Like all those dates are going to be checkpoints, and you're going to get the last one once you meet it. That's going to be your date. Dimple says, I always smile when I say your name, Dimple, and as I drink your coffee. Who did you say to contact for concentration issues? That would be mental health, a counselor. I also saw a chiropractor earlier today, and she is sending me for x-rays with one of the hospital affiliates. We'll have a perfect. That's good. Because while the chiropractor herself may not be an acceptable medical source like a orthopedist would be, the x-rays are being done by a professional in a hospital or any other diagnostic center where they're licensed to do it. And it's being read by a doctor, the radiologist, a specialist. So that's William S. says, inside the envelope on the short form. Always explaining why it freaked him out, right, William? Was a date in very large font. Was this a due date or a start? What did it say? I don't know, William. I have to see it. I received the letter one day before the printed date, which freaked me out again. Oh, so it's not clear. Sometimes, and this is going to make you even more confused, I have seen letters that got here super fast for some reason, and they are post-dated. So I get it the day they sent it, and the envelope, well, it's not the day they sent it. The envelope says when they sent it, right? The postmark, but the postmark on the outside will be before the date on the inside letter. And that's been going on for years. I don't know why. Anyway, it's a short form, so that's a positive, William. Grab the positives. The Rocho's in the house with the pretty flower. Hello, everyone. Stephanie, happy to hear your all things Social Security. Oh, thank you for being here, LaRocho. It's always good to see you. Joel's in the house. Joel, have we met? I know there's been a Joel in here. Was that you? Or is it Joe L? I see a capital L. I think it's Joe and then L.